Of a body mass index chart. That's what you're looking at right here is a body mass index chart, and it's a great tool, and it works for about 90% of the population. Body mass index chart, you just find your height in inches on this column, and then you find your weight along this column. It'll tell you whether you're normal weight, overweight, obese, or extremely obese. Ideally, we want to have a body mass index of below 25. And for every 1 point your body mass index increases over 25, you can pretty much write off about 1 year of life. Right now, 2 out of every 3 Americans, this is being recorded in December of 2010, and right now 2 out of every 3 Americans fall into this overweight, obese, or extremely obese category. And it's been said by the year 2025 that number is going to go up to 75%. As I said, this works for about 90% of the population. This does not work for somebody like who's a bodybuilder, who's carrying around very little body fat but a lot of muscle, but yet that individual is still putting a lot of stress on their cardiovascular system because their body still has to carry a lot of that weight. So can somebody have a high BMI and still be healthy? Yes, but I think for 90% and majority of the people listening to this presentation today, body mass index works just fine. But we want to find out what that weight consists of. Okay, and that's why we do the bioimpedance testing. We know that there are some people that are thin and have poor body composition, such as an anorexic. An anorexic is actually a skinny fat person. And they may have a low BMI, a body mass index that's low, but doesn't necessarily mean that they're healthy. And then again, like I said earlier, we may have somebody with a lot of lean muscle tissue and have a high body mass index. Doesn't necessarily mean that individual is healthy as well. So that's why we look at bioimpedance analysis. We always want to make sure when we assess a patient that we look at their body structure. Small waist is crucial. Belly fat is becoming, you hear the phrase more and more about belly fat. Belly fat is the dangerous fat. In Milwaukee here we call it the Milwaukee goiter. And we know that somebody with a lot of lean muscle tissue also is going to have a lower risk of cancer. High lean muscle tissue correlates with lower risk of cancer. So we do this testing called B.I.A. A lot of people will come into our clinic and we'll assess their height, weight, age, and sex. We'll do the test. And we always measure their height and weight. Most people tend to underestimate their weight by 4 pounds. So we're actually going to take your height and weight. We always say that which does not get measured cannot be managed, right? So we'll do that right here in the clinic. And I find the bigger the individual, the bigger the discrepancy. So the average American right now, if you take all the males and females combined, the average American weighs 160 pounds. So if I ask that individual how much they weigh, the chances are they're going to tell me about 156. With that said, if I ask a 320-pound individual how much they weigh, chances are they're going to tell me more like 310. So the more somebody weighs, the larger the discrepancy I see clinically in their weight. So here's how we do the test. We place some pads on the hands. You may have seen similar devices like these handheld body fat testing devices. That is like an inexpensive version that really runs current through the arms and will tell you how much body fat you have in your arms, but doesn't do anything, for what's going on in your abdominal cavity. Doesn't tell you what the composition is of the lower extremities. So that's why we use this one right here, produced by RJL. It's called the Quantum 2 B.I.A. And we'll take take some electrodes, some pads, and we'll clip them on the feet. And we'll take the other one and clip them on the hands. And it looks like this. Patient lays down flat. We'll have the patient lay there for about 3 minutes before we take the reading. And we take 2 readings. One is called resistance and the other is called reactance. Okay. Resistance is inversely proportional to total body water, and reactance is related to the ability of the cell membrane to store an electrical charge. You got to remember that the body is very electric. So we measure resistance. Resistance is inversely proportional to total body water. Reactance is related to the ability of the cell membrane to store an electrical charge. When you have no charge, you cease to exist. If you've ever watched ER and you watch them, they have things hooked up to your body and you see you're alive when the line is doing this, and then when it flat lines, you're dead. What they're measuring is electrical activity in the body. And some people have a low electrical activity, some people have a high electrical activity, or some people have a low charge, some people have a high charge. So we have you laying on the table, we put the pads on your feet, on your hands. We run about 500 microamps through your tissues, and you won't, the beauty of this is you don't even feel it. Okay? We take that data, we enter it into a software program, we enter your name, age, sex, your height in inches, your weight in pounds, and then we also enter the resistance and reactance that we get from the RGL unit right here. Plug that into the software program. It gives us a lot of great information for us to establish a baseline. This is a very interesting chart. This chart shows us complications relative to the loss of lean body mass, which is everything that's not body fat, metabolically active tissue. So if we lose 10% of our muscle tissue, we see impaired immunity. And then there's a 10% increase with mortality. Once we lose 20% of our muscle tissue, we have decreased healing, we have weakness, and we have increased risk of infection. That is associated with a 20% increase in mortality. If we lose 30% of our lean body mass, we become too weak to even sit upright. We get bed sores, pneumonia, and healing can't take place once you've lost 30% of your muscle tissue. This increases your risk of mortality by 50%. And if you lose 40% of your lean muscle tissue, you're pretty much 100% certain of death. And usually what you end up dying from is from pneumonia. So, is muscle important? You better believe it is. There's a condition called sarcopenia, which is age-related muscle loss. And usually right about age 30, starting at about age 30, most people lose about 3% of their muscle mass every year. And muscle is your fat-burning, calorie-burning furnace. And if we're losing 3% a year, the end product ends up being you lose your furnace, and the average American will put on 1 to 2 pounds a year. Okay? 1 to 2 pounds of this. Now what I'm holding up here is 1 pound of body fat. Okay? So as this lean muscle tissue goes away in your body, we see increased body fat accumulation, which is associated with all kinds of health problems such as cancer, diabetes, heart disease, stroke, just to name a few. So here we have 2 individuals. Here we have 2 individuals on this slide. They both are 5'4". They both weigh 118 pounds. If we only looked at the body mass index chart, we would say, wow, these are 2 healthy individuals. But that does not tell us the whole story. So we run the B.I.A. analysis on these individuals. And here's what we find. We have one individual that has extracellular water of 55%. We have another individual on the right that has extracellular water, which is fluid outside the cell, of 37%. Now I want you to imagine a cell looking like a grape. We've all gone to the store and bought nice organic grapes, right? Because we don't want pesticides in our food, so we do all our shopping at the health food store, right? A healthy cell looks like a plump grape. An unhealthy cell looks like a raisin. This individual here with extracellular water of 37%, the goal is always to keep it below 40%. This individual has cells like grapes. This individual who's got 55% extracellular water has cells that looks like raisins. Okay? Another thing that we get, another reading we get with the B.I.A. testing is a reading called a phase angle. This individual's got a phase angle of 8.9. This individual's got a phase angle of 3.3. A phase angle is a general indicator of overall health. It's a reading of tissue resiliency. So let me go to the next slide here. And these are two actual people. This individual, 5'4", 118 pounds, is a world-class athlete. Low extracellular water, high phase angle, is healthy. This individual is battling pancreatic cancer. Phase angle of 3.3. What we see in this slide is that it's a lot easier to lose muscle tissue than it is to add it. Especially when, I always tell my patients, the young patients, pack on as much muscle tissue as you can up until about 30. Because at about 30, your hormones flip. For males, the testosterone levels start to decline, and then once a male hits about 40, the testosterone and growth hormone levels really go downhill. So pack on as much muscle tissue as you can, especially up until about age 30. And then the name of the game is, you may have to work real hard just to maintain that muscle tissue. It's very easy to lose muscle tissue. It's very difficult, especially after age 30, to add muscle tissue. So you see, kids when they're born, a fetus is 100% water. A baby at birth is 80% water. A normal adult, about 70% water. And an elderly person is 50% water. You see, the child here has nice, soft, textury skin, and as we age, we become dried up and less resilient. If you have high intracellular fluid, it generally represents a good nutrient status. The less fluid we see outside the cell, the better. The cutoff we use at 40% is 40%. If we see over 40%, we try to intervene with a detox program. That's what we see here. Extracellular water generally represents that the body is toxic. If we look at this image right here, it's entitled How Toxins and Inflammation Destroy Your Health, and how the medical foods that we use here at the clinic improve your health. Here we have an healthy cell. Here we have the cell that looks like a raisin. This cell has a lot of fluid inside the cell. This fluid has a lot of fluid outside the cell. Why is the fluid shifted outside the cell and in this individual? There's a phrase I always use: the solution to pollution is dilution. And usually when a patient becomes toxic, the body will shift water from inside the cell to outside the cell to dilute those toxins. So we'll intervene with medical foods, and very often we can return that cell status back to a healthy state. So we talked about phase angle. Phase angle tells us how resilient the patient is. Okay. Nobody's lived below a 2.1 phase angle. The highest we've ever tested in this clinic was on myself at 9.1 until I tested the cameraman 2 weeks ago, and he tested at 9.3. So we have a little phase angle contest going here. So Congratulations, Dr. Hyatt, on a 9.3 phase angle.
Thank you.
Phase angle can be considered a global marker of health. Okay, this is a very fascinating slide. This is a 71-year-old male with pancreatic cancer. And what they did is, for the last 127 days of this individual's life, is they did a B.I.A. analysis on this gentleman. And 127 days out from his expiration, his phase angle was about 5.0. And they took a reading every day, and you can see some downtrends and uptrends and downtrends. And like the stock market, our health is very similar to the stock market. Nothing ever goes straight up and nothing ever goes straight down. One of my favorite quotes is, it's not so much where you are, but what direction are you headed. So most people, when they present to our office, they're on a negative momentum trend. So they want some intervention. So we intervene, and we may turn that into a positive momentum trend, but we need to really make some lifestyle changes so we can continue that positive momentum trend. But this individual, 5.0 at about 127 days out from his expiration, and you can see the trend. Even though there were downtrends and uptrends, the overall general trend is down. So low phase angle, low life. When the phase angle ceases to exist, the individual ceases to exist. The higher the phase angle, the better. The higher the phase angle, the more resilient the patient. This study, published in BMC Cancer 2009, found that B.I.A.-derived phase angle to be an independent prognostic indicator for stage 3, stage 4 lung cancer. And by looking at phase angle, we can potentially improve the survival rate of patients with lung cancer. I will take it a step further. I will say prevention trumps cure. I think anybody watching this should get a B.I.A. test so they can find out where they are. Do you want to wait till you have cancer before you start intervening with what we refer to as TLC, therapeutic lifestyle choices? There's things we can do. It's not what you do when you get the cancer. It's what you do when you don't have cancer that keeps you from preventing a lot of these diseases. We know that 80% of cancer, diabetes, heart disease, strokes, all these things, 80% of these things are lifestyle related. So do you wait till you're diagnosed with a problem, or do you be proactive, get this very inexpensive test now, and then do some things along, with our coaching to help improve the phase angle, to help move if your extracellular water is high, to move the fluid from outside the cell to inside the cell. We can do this. We've done it over and over and over again. We can do it with you. Here's a study looking at patients with breast cancer, and this is a very serious problem for any woman. 1 out of every 7 women will be diagnosed with breast cancer. And they found that women that were diagnosed with breast cancer, if their phase angle was less than 5.6, their average length of survival was 23.1 months. So you'd think they'd run this test on every individual that's going in for breast cancer, correct? So what this study found was patients with a phase angle of less than or equal to 5.6 had a survival rate of 23.1 months, while those that had a greater than 5.6 phase angle lived on average 49.9 months. Wouldn't you want to know this if you're diagnosed with breast cancer? Better yet, if you have a low phase angle and you've got a family history of cancer, it's time to take your health serious and intervene. So Louis Pasteur on his deathbed, Louis Pasteur was the individual who came up with the germ theory. And we know the germ theory is not true, because if germs made people sick, there wouldn't be anybody alive to learn about it. It's not, as Louis Pasteur said, Bernard was right. The microbe is nothing, the soil is everything. So it's not the seed, it's the soil. The seed meaning it's not the bugs, it's not the germs. Germs don't make us sick. It's our body's inability to handle the germs and the bugs that makes us sick. So germs aren't going away. They will be here. They were here long before we were here, and they'll be here long after we're here. So what do? The only decision we can make is to increase our body's ability to handle the germs, to handle the bugs, and raise the phase angle. Excess adipose tissue or body fat is unhealthy. It creates arthritis, breast cancer, heart disease, colorectal cancer, type 2 diabetes, endometrial cancer, end-stage renal disease, gallbladder disease, hypertension, liver disease, low back pain, renal cell cancer, obstructive sleep apnea, stroke, urinary incontinence, sexual dysfunction, infertility, fatigue, and depression. Let me tell you, if that stuff doesn't make you depressed, you will be depressed after you get these things. So if you're serious about getting healthy, if you're serious about people that take your health serious, come and schedule an appointment for us for a very inexpensive test called a bioimpedance analysis, and let's see what we need to do. You might be fine, you might not, but we have the tools in place to establish an objective baseline of how your health is doing, what's your biological terrain like, put together protocols that will improve your cellular health, improve your phase angle, increase your ability to fight off the bugs, and not always be sick. We have these here at the clinic. Go ahead and schedule with us as soon as you can. Thanks for your time.